My name is Jessica Lozier, and I'm a second-year internal medicine resident at the University of Connecticut. I grew up in Fairfield, Connecticut, went to undergraduate at Johns Hopkins University, and then worked in development for about 5 years before returning to medical school at the University of Queensland and the Ochsner Clinical School in New Orleans. What brought me to UConn? My decision to come back to Connecticut was multifactorial. At my baseline, I knew I wanted an academic program that would mold me into a strong clinician, period. I also knew my career goals included fellowship, and I needed a program that would prepare me for that, as well as having a strong track record at matching residents into fellowship spots. The University of Connecticut residency program rotates through 3 busy hospitals, and the exposure to working in these diverse settings has the effect of creating versatile and well-rounded residents. UConn also has a phenomenal track record of matching its residents into their desired fellowships. And as someone who will do cardiology or critical care, that was important to me. Outside of academics, the community aspect is very important to me. Having worked for several years before coming back to school, I really knew how important my team and my colleagues would be to my quality of life. The culture at UConn is that of collegiality. Our leaders sincerely care about us as people and not just as numbers. I've always felt that I could call on a senior resident, a fellow, and even an attending, and gotten the backup when I needed it. And what do I like about the program now that I'm here? I really value how flexible the program has been. I have a career interest in global medicine, and during my first year I had the last-minute opportunity to travel to Haiti for disaster relief work with one of my mentors here in the program, to work on the ground for several weeks. The program bent over backwards to make this work for me, truly going above and beyond to make sure that I could take advantage of the opportunity and not to lose the other rotations that meant a lot to me. Another favorite part is how willing my seniors have been to step forward and to be mentors. I've never had a shortage of role models feeding my interests, helping me gain research projects, or giving me their insights. They've certainly shaped the physician and the teacher that I try to be. I'm grateful to be a part of this community, and I'm going to continue pushing myself to make this team the best it can be.